So today we're going to talk about a drug called chloroquine. So chloroquine. So this drug is used for various reasons. Okay, it used to be given for the prophylaxis of malaria. It's usually given by mouth, and for adults, the dose is usually 150 milligrams per day. Okay, 150 milligrams daily or per day, and a maximum of 2.5 milligrams per kg per day. Okay. So for example, if someone is 100 kilograms, then he will be needing 250 milligrams of chloroquine per day. Okay. So if someone is 100 kilograms, he will need 250 milligrams of chloroquine per day. So when we talk about chloroquine, you have to be cautious of patients who are in the elderly category. Okay, the elderly, and then people who have G6PD deficiency, and patients who are on long-term therapy should have regular ophthalmic examination. Okay, and this drug can aggravate myasthenia gravis. Okay, MG. It can also exacerbate psoriasis. Okay, and also neurological disorders, especially epilepsy. So we have to avoid giving chloroquine for malaria prophylaxis if someone has a history of epilepsy. And also we have to be cautious in patients with severe gastrointestinal disorders and also acute porphyrias. Okay, in these conditions, we have to be cautious when starting the patients on chloroquine. Okay. So chloroquine is a drug that should be considered. Okay, should be considered for treating chronic inflammatory conditions. Okay, chronic inflammatory conditions only if other drugs have failed. Okay, so this is not a first line kind of drug. It's only if you have no other options, you might want to consider giving chloroquine. Okay, you can consider giving chloroquine if you don't have other options. So what are the adverse effects? Okay, adverse effects of chloroquine. So the common ones are, or very common ones are gastrointestinal disturbances, okay, GI disturbances, and then we have headache, and then we have itchiness, rashes, and also skin reactions, okay, other skin reactions, okay. So this could be, could be lumped into one, okay, skin conditions, and also probably this one too. So these are the common adverse effects of giving chloroquine. There are so many uncommon adverse effects related to chloroquine. We have convulsions, discoloration of mucous membranes, discoloration of nails, and also the skin, ECG changes, okay, changes on the electrocardiogram. We have hair depigmentation, we have alopecia or hair loss, keratopathy and ototoxicity, retinal damage, okay, visual changes, okay, and that's why we recommend patients who are on chronic chloroquine to have an eye check with an ophthalmologist, okay, because of the potential to have retinal damage. Okay, the rare ones for the rare adverse effects include acute generalized xanthematous pustulosis, okay, agranulocytosis, okay, which can be dangerous, okay, if you have a severe infection, pneumonia, for example, you might have sepsis and someone might die because of that if it's not treated. Angioedema, okay, aplastic anemia, blood disorders, bone marrow suppression, cardiomyopathy, emotional disturbances, exfoliative dermatitis, hepatic damage, allergy reactions, hypersensitivity reactions, mental changes, myopathy, okay, problems with the muscle, pain in the muscle, neuromyopathy, neuronal problems, photosensitivity, psychosis. You can get Stevens-Johnson syndrome, which is a severe kind of skin reaction, allergic reaction, thrombocytopenia, which is a reduction in the platelet count, urticaria, okay, which is a generalized kind of rash. And then we have other adverse effects that we are not very sure of the frequency. Okay, we have diffuse parenchymal lung disease. We have drug rash with eosinophilia, okay, and systemic symptoms. We can have extrapyramidal symptoms. Okay, extrapyramidal symptoms are the effects that you see in patients. It's the manifestation of Parkinson's disease. Okay, so you have rigidity, you have slow movement. Okay, you have tremors. Okay, and then patients also might get low blood pressure, hypotension, visual disturbances, and also bronchospasm. So in terms of pregnancy and lactation, okay, pregnancy and breastfeeding, the benefit of use in prophylaxis and treatment in malaria outweighs the risk, okay, associated with taking this drug. So, and obviously because of the severity of malaria, so it's the benefits outweigh the adverse effects or the risk associated with taking this drug. For rheumatoid disease, I was talking mainly about pregnancy, okay? So we're talking about the benefits outweighing the risk in pregnancy. So now let's focus on pregnancy first, okay? So for pregnancy, if someone has rheumatoid disease, so it's not necessary, it's not required to withdraw to stop an antimalarial drug during pregnancy if the disease is well controlled, okay? So if the disease is well controlled, we don't have to not necessarily withdraw an antimalarial drug. So that's for pregnancy. And then now we talk about lactation or breastfeeding. So for lactation, so the drug chloroquine will be present in breast milk, and therefore we have to avoid breastfeeding when it's used to treat rheumatic disease. Okay, when you use chloroquine to treat rheumatic disease, then you should not take chloroquine. Okay, you should not be breastfeeding. Okay, so you have to avoid lactation. If someone is lactating, she should avoid that. Okay, she should not be breastfeeding. Okay, if she's taking chloroquine to treat rheumatic disease. However, if she's taking the drug for malaria, then the amount in milk will be too small. Okay, it's too small. It's too small, so it's it's too small that it should not be harmful for the baby. Okay, should not be harmful for the baby when used for the treatment of malaria. So it's a yes in malaria and no in the treatment of rheumatic disease. Okay, lactation in malaria is okay, but not okay when you're taking chloroquine to treat rheumatic disease. So when we talk about, let's talk about overdosage. Okay, so this drug is very toxic in overdosage, and it's extremely hazardous and difficult to treat. So when facing this kind of condition, so the patients might present with arrhythmias, okay, which can have a very rapid onset. Okay, it's a very fast onset, and also they can have seizures, okay, convulsions, which can be intractable. So in these situations, one has to call the National Poisons Center or National Poisons Information Service, or whatever you have in your own country. Let's talk about the drug in patients with hepatic impairment, patients with problems with the liver. Okay, so we have to use the drug with caution in patients with moderate to severe impairment. Okay, so patients who have moderate to severe impairment, you have to be cautious. But if the patient is just having mild liver impairment, then it should be okay. With regards to renal impairment, they are only the drug is only partially excreted by the kidneys. Okay, therefore we don't have to reduce the drug dosage for prophylaxis of malaria, except in patients with severe renal impairment. We have to reduce the dose in patients with rheumatoid arthritis and lupus, systemic lupus erythematosus. So chloroquine is used to prevent and treat malaria and amoebiasis, while hydroxychloroquine, okay, is used to treat rheumatic diseases such as systemic lupus erythematosus, rheumatoid arthritis, juvenile idiopathic arthritis, and Sjogren's syndrome. Okay, so this is according to one article. So hydroxychloroquine, how is it different from chloroquine? So it is just a metabolite. Okay, it's a metabolite of chloroquine. Okay, and they have quite similar profiles, except for a bit of difference in terms of the adverse effects. Okay, because hydroxychloroquine is a bit less toxic compared to chloroquine. And nowadays, many centers throughout the world, they are trialing hydroxychloroquine to treat coronavirus COVID-19. Okay, so they are using hydroxychloroquine, which is something like chloroquine, to treat COVID-19. Okay, I think that's all for now. Okay, we'll see you people in a different series of presentations. Okay, bye.